And it comes as shocking new research reveals a massive rise in cancer cases among men, with predictions that that number will skyrocket by the year 2050. According to the research published in the Cancer Journal, between 2022 and 2050, cancer cases among men are projected to increase 84%, from around 10 million to 19 million. And while male cancer deaths are expected to rise 94%, including a 117% spike among men ages 65 and older. So researchers say men tend to have higher risk factors than women when it comes to cancer, things like drinking, smoking, exposure to carcinogens in the workplace. So let's bring in an expert. Joining me now, Mount Sinai oncologist, Dr. Thomas Marron. His research focuses on development of cancer immunotherapies, which are so crucial. Dr. Marron, thank you so much for your time here. So this new research shows this current sharp disparity in cancer mortality in cancer cases among men, that it's likely to increase without interventions. So in your estimation, Dr. Marron, is the publishing of this study making people aware? Is that possibly a much needed intervention?
Absolutely. One of the biggest barriers that we're facing is that patients are not doing two things. They're not undergoing cancer screening, which lung cancer is the #1 killer now, and as it will be in 2050. And there is an accepted cancer screening, at least in the United States, where people can do low-dose CT and find these cancers early, where it's very easy for us to kill them, before they've spread, and it's a much harder, higher barrier to treat those patients. So, identifying early on, but also prevention is the #1 thing that we should really be focusing on, that this study really highlights. And nearly half the cancers that patients are going to die of in 30 years, and also that are dying of right now, are really preventable. And like you mentioned, men have a higher rate of smoking, higher rate of drinking, which also leads to cancer. And they're also being exposed to a variety of environmental factors that we can potentially alter in the workplace to decrease the toxicity to their lungs and to other organs where they're developing cancers.
All right, so Dr. Marron, I see these numbers and, I hear everything that you just said. Obviously, you're the expert. That is all valid. But, screening, risk factors, prevention, those things are not new. So why are these numbers so stark? I mean, what is going on with men's health?
I think there's really two issues. One is that men are less likely to undergo screening. And if you look at the number of patients that actually should be doing lung cancer screening, for instance, that's my expertise, it's really a tiny fraction. Sometimes we're talking about single digits of the actual number of patients that should be undergoing screening actually receiving the screening. And so I think that these sort of alarming studies are extremely important for us to discuss, because there is a way for us to reverse the trend towards the sudden spike in cancer deaths. I think that there's another thing that we should be focusing on, and the research that Biden's new initiative is hopefully going to help is early detection. And so we can, with lung cancer, we're able to identify very early on if patients have early stage cancers that can be treated. The #1 cancer that's really going to be skyrocketing in the next 30 years is prostate cancer, and that's really a global issue. And there we don't really have a good screening mechanism. In the past, we used to do PSA screenings. Now we know that that is not the best way to identify patients with the highest risk cancer. So we need more research in order to identify the patients very early on so that we can treat them when the cancer is much easier to treat.
Yeah, and Dr. Marron, as somebody who just finished cancer treatment, who I had no symptoms, I had no signs, there was nothing. And these numbers are terrifying to me. And I'm a woman. What is your advice to men who are watching right now?
I think #1 is going to your primary care doctor and identifying all the preventative measures that you can do, like quitting smoking and cutting back on drinking, and also identifying all the sorts of screening that you should be pursuing and how often you should be pursuing it. A lot of the times it's up to patients to really be proactive about pursuing these sorts of tests. Some doctors, they don't have enough time to discuss this. A lot of people don't go to their primary care doctor enough to begin with. And so it's really up to patients to go out there and be proactive and say, what should I be doing to prevent myself from A, developing cancer, or B, if I do have cancer, identifying it early so that we can treat it much more easily.
Thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.